Hi guys, and thanks for tuning into my channel. Today I'm going to be talking about all things nursing. Today's topic is going to be on how to choose the best nursing school for you. I'm a senior in high school right now, and I've just now finally decided which nursing school I'm going to be going to. But ever since I was a junior in the beginning, I always had a hard time thinking of where I wanted to go to college. And it wasn't until probably the summer before my senior year that I kind of came up with the list of the things that I actually wanted in a nursing school. And some of those things I was like, wow, no one's ever really told me about this. So I wanted to create this video to help any of you who are maybe thinking about going to nursing school or choosing the nursing school now, or thinking about the nursing field but you're not too sure if that's the field that you really want to go into. So I wanted to make this video so that everyone out there could recognize and see some of the things that are actually really important when it comes to choosing a nursing school. Nursing is a major that isn't just a major. Like, you just don't go to your typical university and get your degree and be done. There are so many opportunities out there for nursing that you really have to think about. So some of the things I'm going to be saying may apply to you. Some of the things may not apply to you. It just all depends on your situation. I'm not going to just talk about people who are going from the senior to college transition. You could be out of high school for 2 years and you just now decided that nursing is the field that you actually want to major in. Maybe you are a college student now who's majoring in a whole nother subject of science related and you're just now realizing that you want to switch from that major over to nursing. I'm going to talk about everything in a whole of how to choose the best nursing school for you. So the first thing that I came up in my mind, of course, was the most important. What qualifications are you looking for in a school? When I thought of nursing school, I was like, man, I'm going to go to the biggest university in Ohio from where I'm from. Maybe you're from a different state and there's just this college that everyone root for. In Ohio, it's Ohio State. From freshman year, I was like, yeah, I'm going to go to Ohio State. Well, then I learned that there are some qualifications when it comes to nursing that maybe going to university isn't the choice for me. First of all, going to university in a big school is going to cost a lot of money. I mean, there are some nursing schools that are about here, and then there's universities who are all the way up here. And even though you're paying top dollar for your school, you may be getting better qualifications from the school that costs way less. For example, if you're going to university, your average time that you're going to spend at the university is 4 years. In my experience, I found out that you can get a bachelor's degree in 3 years. That's pretty awesome to me, especially since nursing is such a high demand career for some people. Everyone wants to be in nursing, and it seems like when they go into their freshman year of college, a lot of those people will transfer out of the major. So when everyone says that they're going to start in nursing, not everyone's going to end in nursing, if that makes any sense to you guys. So for me, when you go to a university, there are a large population, and maybe to you you're like, well, it doesn't matter if there's like a big population. I don't mind. I want to make friends. Here's the thing about nursing school. Nursing school is nursing school. It's not classes to college. I mean, when you have to go into nursing, you really have to apply yourself to what you're learning. You're going to be taking 3 to 4 science classes in 1 year. Like, that's a lot of science. You think taking 1 science class in your high school is going to be crazy? College is 4. I know the college that I'm going to, I have to take 5 in just 1 year. It's just crazy. Those are just the kind of things that you're going to have to really apply yourself to. And what you get on those science classes, like your grade and your GPA overall, it's going to depend whether or not you get into the actual nursing clinical part. And maybe that's something that's really confusing to you guys is, I have to take these classes, but then I want to be in nursing, so am I actually learning nursing, or what happens? Typically in a university, 2 years you spend doing your prereqs. They split it up so maybe you're not taking 4 science classes in a year or even a semester. They kind of split it up for you. And you also have to take like philosophy classes, you have to take a math class, you have to take some English. A lot of it though is psychology, how your mind works, how the body works, because that's what nursing is. So you have to learn about all those basic things before you actually get into the whole nursing part of actually going in and how to put an IV in and how to take blood pressure, how to do all these nursing skills. And then after you finish your prereqs, then you'll spend your last 2 years, junior, senior year of college, going into hospitals depending on what partnership your school has with the hospital. So that's where I'm going to get to the whole waitlist part. If you're going to go to nursing school, you really have to watch yourself, because universities may or may not have good partnerships with hospitals. And if they don't have partnerships, it's going to be really hard for you to get clinicals. In order to get your nursing degree, your RN, you have to have clinical experience, depending on what state you live in, I guess. In Ohio, for sure, and the majority of the states, for sure, you have to have clinical experience. You actually have to practice those skills that you're learning in the classroom outside, which is maybe really different for some of you. So, waitlists are going to be really huge if you go to a university. Everyone wants to go to university. If you want that university life, maybe that's a choice for you, but you have to expect that you could be turning a 4-year program into a 5-year program, because you have to sit on a waiting list with 1,000 other students who are trying to get into the nursing field. So, really depending on the school that you go to, you have to think about clinicals. You may have really good clinicals at the university that you go to, but hospital-based nursing schools are probably going to be the best choice for most nursing majors. 1, because you're getting into your clinicals really fast. 2, they only offer nursing degrees, maybe other nursing degrees like pre-med or something, but it's all science and healthcare fields related in that nursing school. So you're not having education, and you're not going to have law, and you're not going to have all these majors all in once. You're going to make friends because you guys both want to do the same thing, which is healthcare fields. And they're going to get you into the clinicals, they're going to get you out, and you're going to graduate within your 4 years. And sometimes, even the nursing school that I'm looking at, I can get my bachelor's in 3 years, because literally right next to each other is a hospital, then the nursing school. Hospital, nursing school. And actually the nursing school does their clinicals right next door, and they get in and out fast. So 3 years I'll graduate with my RN degree. So you really have to think about some qualifications that you're really looking for. Is it worth it to go to university? Is it worth it to pay that amount of money for nursing school? Some colleges, hospital-based, are pretty expensive, but you're getting more for your money. You have to think about that. The next thing that you need to really think about is, what kind of nurse do you want to be? With a nursing degree, let me stress to those that are kind of in between the nursing, you can go anywhere in the nursing. So the next thing that you're going to kind of have to consider is what kind of nurse you actually want to be. Let me stress to those that are kind of struggling with, do I really want to be a nurse? Do I really want to apply myself this much? Is it worth it all? Do I really want to deal with vomit, spit up, and blood, and codings? And it's a lot to do. Let me tell you, being a nurse is really for only some small portion of the population. So when I tell you about how great nursing career is, let me stress to you that I'm not saying that this is the career for you, because there's money, there's benefits, there's opportunities in this career. I'm going to tell you all about that if you're kind of in between. Make sure within yourself that nursing is for you. So, as I was saying, in nursing, there is a lot that you can do with a nursing degree. Maybe you don't want to deal with spit up all the time. Maybe you don't really want to have patient interaction. But you want kind of to be in the healthcare field. And maybe you're not quite sure what you want to do. I would say that nursing would be the top career or major that you would go into if you know that you want to go into health but not sure what atmosphere, because you can take nursing and kind of spread it to any direction that you want. You can go into psych, you can go into management, you can work a 9-to-5 office job with an RN degree. You can. There's possibilities out there. There's businesses who will hire you with your RN, and you'll sit at a desk, and maybe surgeons will call you and say, hey, I need to get an instrument, or maybe they need to order some supplies from you. You can do that with your nursing degree, and it's specifically for RNs only. So there's a lot you can do. You could work in a school atmosphere. You can work in a hospital atmosphere. You can work in a physician's atmosphere. You can work pretty much anywhere you want with a nursing degree. So when choosing this nursing school for yourself, you need to think about what kind of nurse you want to be. Maybe you want to get your associate's degree first. Maybe you want to get your bachelor's degree. Maybe you want to go straight into master's. If you get your master's degree, you can work in administrative. You can be a charge nurse. You can be a case manager. You could do so many different things. And I'll make a video completely on what being a nurse actually means to people and knowing if you are the person to be a nurse. But with choosing with a nursing school, you need to see if that's what you want to do. I stress to you, though, those of you who are considering to getting an associate's degree in nursing, I was in your shoes. I was like, I can become a nurse in 2 years, make the same amount of money, maybe a little bit less, do what I want to do, and then get my bachelor's. There are programs out there specifically made for associate's degrees only. And when you choose those schools, you really have to make sure you need to get really deep down inside and kind of study and research that college and make sure that when you go to get your bachelor's, you can get your bachelor's from anywhere else, not just that school that you're going to, because something can happen. Maybe you get your RN and your associates and then you need to go move across the state. I mean, you just never know. Sometimes there's simulations where you have to get your bachelor's from them. You really have to watch schools and know what kind of nurse you want to be. Also, by the year 2020, they're estimating that every nurse in America will have to have their bachelor's degree. So, I encourage you who are thinking about associates to go straight into a bachelor's. I was there, but then I found a nursing school where I can get my bachelor's in 3 years, and I was on that. So, make sure that, you're choosing a school based on your wants and your needs. Another thing I'm going to stress to you is going from a high school to a college atmosphere, qualifications with nursing. High school is going to be really easy this year compared to how things are going to be your freshman year of college. I know this because I've witnessed it with my own 2 eyes of the transition that you go into. If it's a competitive school and they're selecting you on your GPA, you really have to focus your first year of nursing school. Make sure that the nursing school that you're going to is going to meet your needs of how you learn. Some nursing schools are more like setting based, as in you're going to be in the lab a lot, and then there's nursing schools where you're doing a lot of book work. So when you tour these colleges and all these nursing schools, you really need to check and see if the learning style is going to be for you. Also, another thing is if you're going to be choosing a nursing school, but maybe you're not right out of high school, maybe you're coming right out of working a part-time job or a full-time job, and you're realizing that maybe the money's not so good and maybe you need to find a career that's meant for you and go back to school. Maybe you took 2 years off, maybe you took a year off, maybe, who knows, maybe you took 6 years off. A lot of colleges, if you haven't been in high school for so many years, they will require you to retake some not necessary prereqs, but pre-prereqs, if that makes sense. In order to take your prereqs, you have to take some basic classes like biology and chemistry and anatomy. Some, just depending, usually it's biology and chemistry, and you have to have a lab with it. So, if you're considering going to nursing school, make sure that you check that nursing school because you could be wasting a lot of money on paying for some basic classes because you haven't been in school for a while. There are nursing schools out there specifically made for people who want to go back to school and aren't coming right out of high school. Those colleges, pretty good. There are some of them are accredited. Make sure that you do check what accredited is. I'll talk more about what accredited is in a minute, but in general, maybe you're coming from high school to college atmosphere. A lot of high school seniors want to experience sorority, campus. They want to get out of their parents' house. They want to be on their own. They want to, have that college feel. Nursing school is not impossible in those places. I'm not saying at all. For me, being in a university is definitely not what I would want. You have to think about how much money you're going to spend, how much you're going to spend living on campus, how you're going to walk around on campus. Some campuses require you to walk on your feet. They don't offer bikes. You can't have your car until your sophomore year. A lot of that you really had to think about. So accredited. Accredited means that some evaluation people came into that college and walked around the school, had a little piece of paper, and checked off whether or not the school seemed pretty qualified to administer RN license and to administer degrees. If you want to get your associate's degree, they have to get approved that they can actually give you that degree. So when you choose your school, make sure that. Another thing is when you need to transfer credits, if you're coming from another college, deciding that you want to be in the nursing, a lot of your credits will come over, but if it's not accredited, it's not going to transfer your credits. So you really have to check for that, because you're going to be needing to pick a school that's going to accept those credits so that you're not A, retaking classes, and B, wasting money. It's a big thing that we have to think about. Another thing is you need to think about the cost. Like I said earlier, some schools are really expensive with really bad clinical experiences and really bad waiting lists. Like, those are the top two things that you really need to stress to yourself when choosing a nursing school: clinicals and wait list, because that's going to push your degree really depend on the kind of nurse that you're going to be. Another thing is you need to think about is if you're looking to do a part-time or full-time school. Usually universities aren't going to offer you to be part-time, obviously. Some schools aren't going to offer part-time. It's going to be more of those colleges that aren't really accredited, which it's not impossible to get a job without the accreditation. It's just really, really hard to find a hospital to take you in as their own without that kind of accreditation from the college that you choose. So, with the whole basic picture of what we need to look for when we're choosing our nursing school is A, what qualifications do you have of what kind of college atmosphere you want to put yourself in, and if waiting on a waiting list for 2 years or 1 year or 6 months is going to be worth it to you. Another thing that you need to think about is the kind of nurse that you want to be. Do you want to get your associates? Do you want to get your bachelor's? Do you want to get your master's? Do you want to become a nurse practitioner or doctorate? Another thing that you need to talk about or think about is, where are you at in your life? Are you coming from a high school to college atmosphere? Are you coming from college to college? Are you coming from no college to college? Really watch what school you choose. Some schools are greatly mixed. The school that I'm going to be going to is greatly mixed. There's people from coming out of the Army that are coming into nursing school. There's people who have transferred from like math majors. There's English majors transfer, arts credit transfers. There's a whole variety. Make sure you kind of look at that, because you don't want to feel like left out and alone, and you don't want to be like 28 years old while going to school with a whole bunch of 19-year-olds. It just wouldn't be the place for you. Another thing you need to think about, is it accredited? Remember, we need to make sure it's accredited, because without accreditation, they're not really supposed to be administering you any of your degrees or certifications. And then the other thing is transfer. Can any of your classes transfer? Being in high school, sometimes you have the opportunity to take college classes. You need to make sure that those classes that you're taking, which if you are in your junior year and you're thinking about doing that, you need to kind of look at the basis of what colleges you're really looking for. See what classes that it requires you to take in nursing school, which I recommend if you're going to take any college classes. A light load would be taking English. Second load, I would say English and psychology. Third load, it would be anatomy, psychology, and English maybe. A law and ethics class would be really good too for a nursing degree. Another thing you need to think about is the cost. Sometimes the big schools, pretty schools that have good reputations as a university aren't going to be so fulfilling as a college that is not a university atmosphere, but does the same exact thing that they do. Sometimes they're even better. Another thing you need to think about is, do you want to go to school part-time or full-time? Depending on the class loads that you want to take. Is it going to be worth it? Is it going to be a long haul for you? Because you have to remember, nursing is going to be really hard. So yeah, that is what I have today for you on how to choose the best nursing school for you. I hope you guys really liked this video. I hope that it kind of opened up your mind to some of the things that maybe you haven't realized in the past about choosing a nursing school. Again, I will be doing hopefully weekly videos about different things that have to do with nursing. If you're interested in what kind of stethoscope I'm wearing, it is a Littmann, and it's in the Breast Cancer Awareness Classic Pink, and it is just a classic Littmann stethoscope, and I want to throw it out there to all you nurses who are out there wearing your stethoscopes. I applaud you. Being a nurse is going to be a really hard adventure for me, and it's going to be an experience. I'm so excited to be a nurse, but I am so thankful that we have some other nurses that we do today, and I hope you guys wear your stethoscopes with pride. Thanks for watching, and I love you all, and I'll see you on our next adventure of nursing. Thank you.